Goes live. Save the fish! Save the fish! We're waiting on Jessica to get back from saving the fish. She has designed her own little pond, and upon doing so, has put a bubbler in there, and it keeps flipping over and draining the pond. Her last 48 hours have been something else.
Yeah, they have. I tried to burn down the house. I flooded the house. What else did I've done?
Yeah, that just
tried to kill the fish. That's happened twice today, but the first time this morning it was all the way empty almost. But they're fine. I saved them all.
So, well, welcome to the drama. Trying to get her to stuff just happens in life, and you just really can't worry about it because it's going to happen.
Oh, yeah. And the air conditioning decided it wasn't going to work. It was going to freeze up.
Yep. But you had nothing to do with that.
I planted flowers. That's how I dealt with it.
So tonight's 7 o'clock topic is on pain. And it is on all kinds of pain. Fibromyalgia pain, joint pain, and all of the things. And so I wanted to kind of talk about the medical perspective, even the chiropractic perspective, and we work off of what is called pain gate theory. And pain gate theory states that you can only have one major pain stimulus at a time, but anybody that has fibromyalgia knows that you can have pain everywhere all at once and it hurts. And so there are different reasons for pain, and Jessica's passion is hormones. And hormonal pain can lead to all kinds of stuff. You can take it from there.
Well, the lack of hormones can create pain. So if
or too much hormones.
Or too much. An imbalance, that's what we should say. An imbalance of hormones can cause pain. So, for instance, like a female that has low testosterone might have joint pains all over. But you'll notice it when you wake up in the morning and you step down and you have to warm up. You got to step down slow. So some of that can be attributed to hormone imbalances, specifically testosterone.
Gotta love living in the country. I love living in the country. The rednecks are awesome, and I am one. So that's okay. But go ahead. And you were talking about testosterone.
I finished my statement.
Gotcha. So lots of times, joint pains, whether it be in the neck or elbow or fingers or hands or knees or plantar fasciitis, that stuff can all absolutely be related to hormonal imbalances. And you have to have an assessment of the hormones. The next thing I want to talk about, we talked about joint pain. I want to talk about pain that comes from the mitochondria. And so at this point in time, I want to talk about pain that moves all over the body. So when someone has pain and it stays in one joint, that could be just damage to the area. It could also be hormonal issues. But then if you have pain that goes from this joint to the neck, to the low back, whatever the case may be, you're now talking about a different type of pain. And that pain can be both hormonal or it could be mitochondrial. And this is where we start to talk about fibromyalgia, because a lot of the times, especially in my practice, or in our practices, I should say, we see people with pain that's all over or it moves, And that tends to be the mitochondrial and hormonal. It'd be great if it was one type of pain, one problem, one deficiency, and that's it. And a lot of times it's the mix. Don't we see that? I mean, we see hormones, and then we see the organic acids pointing to the mitochondria or even the liver. So there's all kinds of stuff that goes to pain, and that's one of the things I was listening to um, Poor Charlie's Almanac, and this is Charles Munger talking about basically his philosophy and his investing techniques and basically ways to think. And you have to realize that Charles Munger grew up in his mentor was a medical doctor. And so we're talking about a guy that died last year at 99 years of age. And so in his Poor Charlie's Almanac, he talks about chiropractors being the boobs of medicine. And at first, I kind of took offense to that, but then he goes on to explain that chiropractors that are just chiropractors look at everything as being the subluxation. And so he talks about man with a hammer syndrome. And so man with a hammer syndrome is everything, a man with a hammer, everything looks like a nail, looks like it needs to be hit. So that's the way orthopedists are. That's the way your specialists are typically. That's a gross overgeneralization, as it is a gross overgeneralization by Charles Munger. But if you start to get people who think about the whole person, now all of a sudden, well, there might be a structural component to that. And depending on the person's age, there's probably most certainly a hormonal issue. And then once again, depending on the person's age, there's probably a mitochondrial issue. And so if you can start to address all of those issues and allow the body to start to work through those issues by relieving body burden, by increasing mitochondrial function, by balancing hormones, now all of a sudden the person starts to feel like $1,000,000. And we have, well, almost 80-year-olds now who feel like $1,000,000, and they're back on the touring schedule. They're back to presenting for their church, and they're traveling all around. They are professional speakers, for lack of a better word. And so, you know, when you see these things, there are ways out of it. If you have hormonal issues, you can start to supplement the hormones. And how long does it take to get out of it? How long have you been this way? Nobody knows. There isn't a doctor in the world that can sit there. If they can sit there and tell you, hey, this is going to take 6 weeks, by all means, hey, they are better than me. But typically, we really don't know. And it's one of those things where we have to work through the steps and the problems to start to reverse the issues that people have. And, there's a ton of different ways to treat. Like I said, we can treat with hormones. If you're having problems with the mitochondria, maybe it's some CoQ10 and magnesium and amino acids. You're very safe in telling people, hey, you should take magnesium and you should take CoQ10. But there are nuances to it. And when you start to do testing and looking at what's causing people's pain, then you can start to get into those nuances, and you start to figure out, is this a mitochondrial issue? Is this a hormonal issue? Is this a liver issue? Does the person not have enough omega-3 fatty acids? What's the problem that we are seeing, and how do we start to address it? And it goes, case in point, when Jess was going to go have her procedure done, the first thing I did was called our nutritionist and said, hey, she's going to go do this. I'm going to put her on proteolytic enzymes. What's the latest and the greatest on modulating the immune system and helping her heal up? And he was like, oh, the SPMs. And we designed a protocol for her that she started, 3-4 days before?
Yeah, but the SPMs we just added the day before, didn't we?
I think so, because that's when we got them in.
But I didn't take pain medicine very long, like 6 days and then one dose.
Yeah. And then, I mean, honestly, the tail of the tape on this is her orthopedic surgeon looking at her saying, you're sitting, and you were how long out?
I was on day 7. I went into his office with no pain medicine. I drove myself. I was dressed like I would normally dress, wearing high-heeled shoes. And I was sitting and feeling great. I had told him I had been ballroom dancing for a bit. He thought I had been teasing him, so none of which I should have done.
And that's a testament to the work that she puts into it. And we've talked about that for several weeks now.
Well, and I wasn't comfortable. It was tolerable.
Yeah.
But I was not in any sort of pain.
Well, he was amazed you weren't laying down.
Yeah, he was just amazed that I was moving and grooving.
So that...
They usually say it's about a 3-week process before you're up and about.
Oh, well, Lord, you blew that out of the water.
Yeah, I mean, because I'm not even... Today's 3 weeks.
Yeah. So there's a lot of ways to modulate pain. And you can start to... The biggest thing we worry about is systemic inflammation and hormonal deficits. Because if you have those things, you've got to get on top of those before they continue, before they progress. Because I look at it like a car accident. How bad is the car accident? The longer you wait, the worse the car accident. And so then there might not be the ability to reverse what's going on. So, that's just some ways to think about pain. There are assessments. Actually, if you look on the Integrated Health of Indiana page, we just actually did a special. I think it was the omega-3 fatty acid test with vitamin D, which is normally around $300. Over $300 is somewhere in the neighborhood. I think we're doing the special for the first 10, and I'm not sure how many we have left. I don't know that I should say this, but you can get that assessed for $200. That's the vitamin D and the omega-3 fatty acids. And omega-3 fatty acids link to everything. They link to cardiovascular disease. They link to cellular health. They link to inflammation. It's something that you really need to know because it is foundational root cause. God, I hate that term. Root cause medicine. And so with that being said, anything else? Anything to add about the goings on in the community with the homeless? What's the word?
I don't know what the word is. I think we're meeting tonight.
Okay. Well, we'll let you know more about that stuff when we get information on it. And if you would like the content that we put out, go ahead and like and follow. We appreciate it. And as always, you can always ask questions in the chat box, and we will get back to you as soon as possible. Have a great evening.